Hi, I'm Dr. Lewis. I'm one of the junior doctor in GP. Could you please tell me your name and age?
Hi, Dr. Lewis. My name is Mrs. Sophia Jenkins, and I'm 30.
Hi, Mrs. Sophia. How can I help you?
My son has chicken pox, and I'm worried about my unborn child.
When did this happen?
He got it 2 days ago.
Do you have any symptoms?
No, doctor.
Do you have any other problems?
No, doctor.
Alright. Is this your second pregnancy?
Yes, 32 weeks of pregnancy.
Okay. How was the pregnancy confirmed?
Pregnancy test at home.
Were you using contraception?
No, doctor.
Okay. Could you please tell me the estimated date of delivery?
25th March.
Do you feel the movements of your baby?
Yes, doctor.
Could you please tell me the planned method of delivery?
Normal.
Are you taking any medications during pregnancy?
No.
Okay. Have you attended all your antenatal checkups and scans?
Yes, doctor.
Do you twins in your pregnancy?
No, doctor.
How has your pregnancy been so far?
Fine.
Did you develop any complications?
No.
Alright. Have you been diagnosed with any medical conditions in the past?
No.
Okay. Have you had chickenpox when you were a child?
No, doctor.
Are you taking any regular medications including OTC drugs or supplements?
Folic acid, doctor.
Any allergies from any food or medications?
No.
Any previous hospital stays or surgeries?
No, doctor.
Has anyone in your family been diagnosed with any medical condition?
No.
Alright. Do you smoke or drink alcohol?
No.
Do you take any recreational drugs?
No.
What do you do for a living?
Office job.
May I know whom do you live with?
My partner and my father.
Okay. How are they doing?
My father is having chemotherapy.
Alright. I would like to check your vitals, general physical examination and do antenatal examination.
Okay, doctor.
As you have mentioned, you didn't have chickenpox as a child, so you are not immune to chickenpox. That's why you have to take some precautions.
What precautions, doctor?
Alright, before that, as you also mentioned, your father is undergoing chemotherapy, so he has low immunity for now. It would be best to take some precautions for his safety.
Alright.
A person with chickenpox is infectious from 2 days before the spots first appear until they have all crusted over, commonly after 5 days after onset of the rash. A child with chickenpox should stay off school or nursery for 5 days the onset of the rash until all the lesions have crusted. Also, while infectious, they should keep away from at risk of people who may develop a severe illness if they get chickenpox. Whenever possible, the person who has chickenpox should avoid the contact with anyone who has never had it. That also means not spending much time in a room with other people because chickenpox can also be spread through the air. Try to avoid scratching blisters because they may break and the fluid inside is contagious. It may help to keep children's fingernails trimmed and put cotton mittens on babies' and toddlers' hands.
Okay, doctor.
There are some complications that can affect the unborn baby vary depending on how many weeks pregnant you are. If you get chickenpox before 28 weeks pregnant, there is no evidence you are at increased risk of suffering a miscarriage. However, there is a small risk your baby could develop fetal varicella syndrome. Fetal varicella syndrome can damage the baby's skin, eyes, legs, arms, brain, bladder, or bowel. Again, if you catch chickenpox between 28 and 36 weeks of pregnancy, the virus stays in the baby's bodies but doesn't cause any symptom. However, it may become active again in the first few years of the baby's life, causing shingles. Lastly, if you catch chickenpox after 36 weeks of pregnancy, your baby may be infected and could be born with chickenpox.
Okay, doctor.
If you get chickenpox, you may be offered acyclovir, an antiviral medicine which should be given within 24 hours of the chickenpox rash appearing. Acyclovir doesn't cure chickenpox, but it can make the symptoms such as fever less severe and help prevent complications. Acyclovir is usually only recommended if you are more than 20 weeks pregnant, but in some cases your doctor may suggest it if you are less than 20 weeks pregnant. Discuss the risks and benefits with your doctor. To relieve your symptoms, you can try to drink plenty of fluids, take paracetamol to lower a temperature or help with pain, and use cooling creams or gels from your pharmacy.
Will my baby need to be treated?
Once you have chickenpox, there is no treatment that can prevent your baby getting chickenpox in the uterus. After the birth, your GP may consider treating your baby with chickenpox antibodies called varicella zoster immunoglobulin if your baby is born within 7 days of your developing a chickenpox rash, or you developed a chickenpox rash within 7 days of giving birth. And if your baby is exposed to chickenpox or shingles within 7 days of the birth, they aren't immune to the chickenpox virus. However, if your newborn baby develops chickenpox, your GP may treat them with acyclovir.
Okay, doctor.
Alright, you have a higher risk of complications from chickenpox if you are pregnant and smoke, have a lung condition such as bronchitis or emphysema, or have taken steroids during the last 3 months and more than 20 weeks pregnant. There is a small risk of complications in pregnant women with chickenpox. These are rare and include pneumonia, encephalitis, and hepatitis. Complications that arise from catching chickenpox during pregnancy can be fatal. However, with antiviral therapy and improved intensive care, this is very rare.
Okay.
Alright, your baby may develop severe chickenpox and will need treatment if you catch it around the time of birth and the baby is born within the 7 days of your rash developing or up to 7 days after giving birth. If you are pregnant, have chickenpox and develop chest and breathing problems, headache, drowsiness, vomiting or feeling sick, vaginal bleeding, a rash that's bleeding, a severe rash, then you should be admitted to hospital. These symptoms are a sign that you may be developing complications of chickenpox and needs a specialized care.
Thanks, doctor. Bye.
You're most welcome, Mrs. Sophia. Bye.